Hello everyone, my name is Surya. I'm a registered nurse and welcome to Nurse Talk. And I'm going to have a discussion with you about some of the intracranial hemorrhages or bleeding, which is occurring due to head injury for most of the patients. So, before that, I just want you to have an idea about the brain and the covering of the brain. So, here is our brain here. Hope you can see it well. Here is a brain, and our brain is covered with. Uh, Imagine that our brain is covered with a pad. Our brain is covered with a pad. So the pad is pia matter, arachnoid matter, and a dura matter. These are the coverings of the brain. So the first one, who is actually very close to our brain, is the pia matter. Then comes the arachnoid matter, and then comes the dura matter. So remember that our brain is covered with a pad. So here is the pia matter, arachnoid matter, and dura matter. Now I'm going to have a discussion with you about the different types of bleeding, and if the bleeding comes up in the dura mater or arachnoid matter, what will be it called, and what are the clinical manifestations the patient is going to experience or the patient is going to show up where the patient has a hemorrhage or hematoma inside the brain. So, when we are talking about the intracranial hemorrhages, the most important and most dangerous intracranial hemorrhage is epidural epidural hematoma. It's epidural hematoma. Epidural hematoma means this is a dura mater. We can see it here. Epi means above. Okay, epi means always above. So here is a dura mater, and epidural means the hematoma will be here. Hematoma will be in here. And this is the most serious type of hemorrhage seen in the patients who is having the head injury. So this type of, the epidural hematoma is a type of bleeding which is actually rapidly progressing. Rapidly progressing means the patient will go with the severe clinical manifestations and a severe form of distress very quickly. Why is that happening? Because in the epidural hematoma, the blood vessel which is actually affected is an artery. We all know about arteries and veins, and arteries carry oxygenated blood from the heart, and it is very, very fast. And the blood moves so fast that it will spread the blood or oxygen to different parts of the body. So, arteries is having a high pressure inside our body while the blood is flowing through them. So, in the epidural hematoma, the blood vessel affected is artery, and hence the artery is affected. The bleeding is going to be very, very fast and rapid, and the patient is going to have a serious condition in a very short time. So this is the one of the most that is one of the most important thing which makes epidural hematoma a severe condition. And coming to the clinical manifestations of epidural hematoma, once the patient has an epidural hematoma, once the patient had a fall or injury and the patient end up on epidural hematoma, the patient will be having a brief loss of consciousness. It's going to be very brief, that the patient will be having soon after the fall. The patient lose his or her consciousness for a short period of time, and then the patient will come back to a lucid interval. That's one of the most important thing in the epidural hematoma, that the patient is going to have a lucid interval. What does a lucid interval means? Lucid interval means the patient is coming up, that the patient is all right. For example, if you have seen patients who have undergone neurosurgery or head trauma, if in the in the neurosurgical ward or something, we can see some patients, they'll probably will be loss of consciousness, or they will be having cognitive impairment, they'll be having difficulty in identifying people around them, but still sometimes they will come back to their actual life and they will identify their parents or their siblings or their family, and then they will go back. So that time where the patient is actually having a proper ability to identify his environment or the people with him, that is called lucid interval. Lucid means he's actually okay, like me and you, he's actually okay, he can identify what's happening around. That is lucid interval. So especially the patient who is having an epidural hematoma, I said the patient will be having a loss of consciousness. It will be for a brief period. For a short time, the patient will be having a loss of consciousness. And then the patient will be having a lucid interval. Very, very important. And then the patient will go to coma. Okay, so once the patient has an epidural hematoma, this is going to be very, very important for your exams. So you can ask a question. The patient had a head injury and got admitted to the hospital. Initially, patient had the family reported that the patient had initially loss of consciousness, but the patient was all right after that. That means the patient had epidural hematoma. Because if the patient is having a lucid interval and then the patient is going to coma, that is epidural hematoma. Okay, so this is one of the most important thing to remember when we are talking about the epidural hematoma. So now we got an idea what it is. That is epidural hematoma means the hematoma or the bleeding happening on top of the dura mater, epidural. Okay, and this is manifested by loss of consciousness and then lucid period, and then the patient go to the coma, and arterial bleeding is happening here, so the symptoms will be very, very rapidly progressing because the patient is having an arterial bleeding inside the brain. So now we are going to subdural hematoma. So what is subdural hematoma? We can see the dura mater here. Yeah, subdural means below the dura. Subdural. Remember, sub means down there here. Subdural hematoma. Oh, sorry, when I was saying about epidural hematoma, I forgot to say one thing. One of the how will we diagnose the epidural hematoma? Epidural hematoma can be diagnosed by a CT scan. So in the CT scan, when we check the CT scan of the patient, there will be a convex image shown. See, that is a convex here. This is convex shaped. Convex shaped image is seen in the epidural space of the patient when the patient is having an epidural hematoma. Very, very important. Convex shaped is seen in epidural hematoma. Okay, now we go to the subdural hematoma. Subdural hematoma means the bleeding here between the arachnoid and dura mater. This is a subdural space. Can you see that? This is subdural space, and the bleeding will be here. Okay, bleeding will be here. So in the subdural space, if the patient is having bleeding, this is going to be a very slow progressive disease. Why? Because the patient is having venous bleeding here. Subdural space, subdural hematoma means the patient will be having a venous bleeding, and also it is like very slowly progressing disease, as I said earlier. Because it's a venous bleeding, this is going to be very slowly progressing, and in the CT scan, this will show up crescent or moon shaped. The it will be shown like a crescent or moon shape. In here it will be convex, and in here it will be crescent or moon shaped. CT scan will be shaped crescent or moon shaped in the subdural hematoma. So the question comes up like the patient is having a head injury and the patient get admitted to the hospital with the loss of consciousness. The CT scan shows a crescent shaped structure on the brain, like crescent-shaped hematoma on the brain. What is the diagnosis? It is subdural hematoma. So remember, in epidural hematoma, the patient will be always having a convex-shaped structure in the CT scan, and in subdural hematoma, the patient epidural. Subdural hematoma, the patient will be having a crescent or moon-shaped CT scan, moon-shaped evidence on the CT scan of the patient's brain. Now we are going to subarachnoid space. Subarachnoid. Here is a subarachnoid space. You can see it here. If the patient has a bleeding in the subarachnoid space, most of the time this bleeding is spontaneous because of the because it's going to be an arterial bleeding, and in most of the cases this is because of the aneurysm of the patient. The patient will be having an aneurysm, and this aneurysm will result in the bleeding in the subarachnoid space. So now we have learned about three types of hematoma. One is epidural hematoma, subdural hematoma, and subarachnoid hematoma. Among that, epidural and subarachnoid, epidural and subarachnoid, in these two hematomas, the arteries are going to bleed. They are arterial bleeding, and the patient will be having spontaneous, rapidly progressing condition. And in the subdural hematoma, in here, between the arachnoid and dura, subdural hematoma, it will be in the crescent shape. It will be in the crescent shaped on CT scan, and it's going to be a venous bleeding. It's not going to be an artery. It's a venous bleeding, and the patient will be having clinical manifestations very, very slowly. So imagine if the patient is having the bleeding, and the patient is got into the hospital or in the intensive care unit with a loss of consciousness or lucid interval, and then going to the coma or severe headache or vomiting because the patient had a head injury. What is going to be the clinical manifestation, or how are we going to identify this patient that the patient is having the head injury, or the patient is having this type of like bleeding in the brain? So how are we going to identify? So if the patient had a head injury, we need to find out what are the clinical manifestations the patient is going to show. So obviously we know the patient will be having loss of consciousness, as we were saying earlier. And among with the loss of consciousness, the patient will be having headache, vomiting, bradycardia. So we all know bradycardia, what bradycardia means. Bradycardia means reduced heart rate, bradycardia, and CSF leakage. Okay, now my question is, the patient is having a CSF leakage. How are you going to identify? Where is the CSF going to leak? Which way? Okay, so if the patient has a CSF leakage here, the patient is going to have the leakage through the nose and through the ear. Yep. The fluid coming through the nose is called rhinorrhea, and through the ear is called otorrhea. We know rhinitis means inflammation inside the nose. Yeah. So rhinorrhea means the fluid is coming, the runny nose, rhinorrhea. And otorrhea means the fluid is coming through the, ear. So here we can see a patient who is having all these symptoms like loss of consciousness and headache and vomiting and bradycardia, and the patient is coming with the fluid coming through the nose and ear. How will we identify that the patient is having a cerebrospinal fluid leakage? What if the patient has a common cold? Yep. If the patient will not have a loss of consciousness, obviously, if the patient has a common cold. But I'm just saying the patient is having leakage, like fluid coming through the nose and the ear, and the patient is coming to the hospital. How are we going to confirm that this is a cerebrospinal fluid coming out of his nose and ear? So we can do a sterile pad test for that. Sterile pad test. In the sterile pad test, we are going to take a sterile pad or a slide, which is actually very sterile, and we are going to get a drop of the fluid coming from the nose or the ear to this sterile pad, and we can see, we'll leave it there for a few minutes, and then we can see a yellow round and a red dot inside. So if that is a cerebrospinal fluid, if the fluid coming from the nose or ear of the patient is actually cerebrospinal fluid, when we get it to a sterile pad and keep it there for a while, we can see a yellow circle and a red dot inside that. So this shows that the patient is having cerebrospinal fluid leakage. Okay, so if you're doing a computer-based examination, for example, NORSET or something like that, computer-based examination, most of the times the questions will be coming from image-based questions, like coming as image-based questions. So if they're showing you in the image that a sterile pad with a yellow circle and a red dot inside, and they are asking, what is the name of this sign? So this is the, so they can ask the questions like, there is an image and they will ask you like, this is the result of a patient who is having an otorrhea and rhinorrhea, came to the hospital after a head injury. And this is the actual result. And what is the name of this sign? The name of this sign is Halo's sign. Remember, this is Halo's sign. And it's a yellow circle and a red dot in the middle of the yellow circle. This is called halo sign. And this halo sign is used to identify or confirm the leakage, CSF leakage from the patient's brain. So this is halo sign, and halo sign can be seen in the patient who is having otorrhea and rhinorrhea, where they are having a CSF leakage of the patient. So now we learned about what is different types of hemorrhage: epidural hematoma, subdural hematoma, and subarachnoid hematoma, and what is the clinical manifestation and how it is shown in the CT scan. Very, very, very important. In epidural hematoma, it will be shown in a convex manner, and in subdural hematoma it will be shown like a crescent or moon shaped, and in subarachnoid most of the time it is caused because of the cerebral aneurysm. And then we learned about the CSF fluid leakage. In the previous video I have mentioned about the flow of CSF, like CSF pathway, which can be very, very important to your exams, and the CSF leakage will be there through the nose and the ear, and it is called rhinorrhea and otorrhea. And for the confirmation of CSF leakage through the nose and ear, we use halo sign. And how is halo sign identified? It is like we are collecting a drop of the liquid coming from the nose of the patient through a sterile pad, and then we are going to keep it for a while, and then we can see an yellow round like that, and a red dot in the between, in the middle of that. This is halo sign. Very, very important. This is a halo sign, and it is seen in the patient who is having a CSF leakage. I hope you liked my video, and I hope you understand certain things. Just in case if you want more videos, pop it in the comments and I will read it and make more videos. In case if you have any suggestions to make my videos better, Please put that also so that I can learn more things. We are all learning every day. Thank you very much for watching. Bye bye. This is Surya, registered nurse. Bye bye.